Would you like to know why patients routinely lie, why they're rejecting your recommendations for best option care? And once you understand that, would you like to be able to fix the core reason and then skyrocket your acceptance? Stay tuned, because that's exactly what we're going to be talking about right now in this live broadcast here from Planet Gems in PPO Exit. What would happen if the majority of your patients, I want you to picture this, what would happen if the majority of your patients were literally living hand to mouth? Financially, they didn't even have enough to put food on the table for their kids. They had no money for things that they consider luxuries, like even routine dental care. So if you were practicing in an era, in a time, in a location, if you were practicing that in that situation where literally 95% of your patients, they have no money, they got nothing, what would your practice be like? What would your case acceptance be like? All right, that's not happening, but what would happen if either the doctor or the team members believed that that was to some extent true, that a lot of our patients just can't afford, the care that we're recommending? If you believe that that were true, what would happen? And by the way, that's a rhetorical question, but I'll answer it. If you, the doctor, or you, the team member in a dental practice, had a deep down belief in your heart that your patients, most of your patients, a lot of your patients really can't afford the kind of care that you're recommending. And I don't mean a full mouth reconstruction that everybody can just accept, a 40, 50, whatever it is, $1,000 case. What I'm saying is complete dentistry one quadrant at a time, financed over time by one of the financing companies or however you choose to finance it. But the point is, broken down by quadrant, we're going to talk about this and that belief that there's still a significant percentage of our patients who can't afford it. We're going to find out, is that true? Is that not true? How do we know one way or the other? And what will that do to our case acceptance once we solidify that belief? So a number of years ago, this is going way back, when my dad was alive, he owned a practice which I ended up taking over and fixing for him, because when he was dying of cancer, he told Elizabeth and me that he was really stressed out financially. He was $100,000 behind just on the daily bills. His lab and supply he couldn't pay. He was $100,000 behind just on lab and supply. And he had 11 chairs. He wasn't a dentist, but he was owner of the practice. He had 3 GPs, 2 specialists, 3 full-time hygienists, a big support team. And the more dentistry they did, they had 15 PPOs. The more dentistry they did, the more money they lost. And so when he was dying of cancer, he asked me to take that practice over, and he passed away, and I took it over and took care of my mom. And within 2 years, I had turned the Worcester practice around to the point where I was able to eliminate 13 of his 15 plans. Now, we were 95% fee-for-service when I sold that practice, and my practice, I had dropped all my PPOs, gone 100% fee-for-service. So why am I telling the story about my dad's office in Worcester? Well, there was a time, and this is going way, way, way back, there was a time when a couple of his GPs contracted a really serious illness, and both of them were out at the same time. So he had only one GP there, and he said, Tom, he says, we're dying financially. He says, can you come out here one day a week and crank out some production? I said, sure. So I scheduled, a day where I could come out. I was only working, 4 days in my office anyway, so I scheduled a day where I could come out, and I went out to the Worcester office. Now, you got to understand, I was in a kind of an average suburb of Boston, not a high-end, but an average suburb of Boston, but I was doing some beautiful dentistry and getting really good acceptance at really good fees, 100% fee-for-service, since I had dropped my PPOs. And I was a devotee of Bill Strupp, went to all of his courses, did a lot of bonded porcelain reconstruction. Pete Dawson wrote the foreword to one of my books, so I was really I had spent 2 years in the Dawson continuum, and so I did a lot of TMJ and bonded porcelain reconstruction, and I get out to, why am I telling you this? Because I get out to Worcester, and the very first morning I'm there, I'm in the morning huddle, and we're sitting with the team, and a couple of the assistants looked at me, they said, oh yeah, your dad's told us about the kind of dentistry you do in Framingham. And now, if you're a guy, you'll recognize this. Actually, women are going to understand this too. Anybody will understand this. There's a lot of times when a woman says something to a guy, the guy thinks he understands what the woman is saying, but the guy is totally clueless and really doesn't know anything about what the woman really meant. this was one of those situations. I thought she was complimenting me, and my dentistry when she said, your dad told us about the dentistry that you do in Framingham. So I said, thank you. And she kind of looked at me puzzled like, don't thank me. That's not what this is about. So I paused and I said, well, what do you mean? She said, that's not going to work here. Now, we got about 15 minutes left before the first patient. And I'm out there to try to help my dad and their patients. And basically what I learned that morning was that during that huddle was that I had zero support. I had nobody who believed that the type of dentistry and all I was doing was complete dentistry. All I was doing was telling the patients what I believe would be best in my mind, my heart for their situation. And I was getting really good acceptance of that. And so here I am. Okay. So with no staff support, no team support, I get in, and they were nice people. They just didn't believe that any of that would be accepted. In fact, I asked her why. I asked her, why is that the case? She said, well, you got to understand who our patients are. Now, his office was located in an economically depressed area, an urban area. I was in an average, suburban area, but he was in an economically depressed urban area about 45 minutes to the west of my office in central Massachusetts. And she said, basically, all of our patients come from 3 factories. They all have terrible union insurance. They're going to walk in their blue overalls, their coveralls with their name stitched in yellow. And no matter what you recommend, they're only going to do what their insurance covers. And basically, that was their view of their patients. And by the way, because that was their view of their patients, that was all that was being done in that practice. So I said, okay, I hear you. And I ignored what she said. I told her I heard it, but I ignored what she said. The very first patient that I did a re-examination on, re-examine treatment planning, was a nice young man. He couldn't have been more than 30 years old. Yeah, he was wearing, the factory garb, and yeah, he was from one of the factories. And yes, he had the terrible insurance. So he was exactly what she described. But the biggest difference was his mindset was nothing like she described, nothing like it at all. So I went through, I looked at one of the quadrants, which was the worst in my opinion, and I talked to him about what I would recommend there and what I would do for myself, my mother, my brother, my family, and why I would recommend. I went through what I would normally do in Framingham, same kind of presentation, and he said 2 things to me. The first thing is he looked at me, he says, Doc, he says, nobody ever told me it could be done that way. Nobody ever told me it could even be done that way. Nobody had ever even brought it up, that he could have better health. And the second thing he said, let's do it. And so the first day I was out there, I got acceptance of the first quadrant of inlays, onlays, crowns, whatever it was. It was all prosthetic dentistry that I'd recommended for that young man. And that was only the beginning. From there on, it's what I did. Didn't matter where I was. Didn't matter who the patients were. It's what I did, which was to tell them about what I knew would be the best for them long term and allow them to make the decision. And I know you've heard that before, but let it sink into the point where it actually becomes your belief and your team's belief. So there's a story, and you've probably heard this one before too, but there's a story of Dr. Smith and Dr. Jones, and they're both practicing in the same town. Now, Dr. Smith, they're both the same age. They've both been in practice the same number of years. They're only about a block away, so they're in basically the same town a block away. Dr. Smith's only doing $500,000 a year. Dr. Jones is doing $1.5 million. Dr. Smith is just barely struggling to get by. Dr. Jones is really enjoying dentistry, giving really great care for his patients, and his patients are benefiting, and he and his family are living well as a result, and the team is getting great bonuses, and it's a wonderful practice. So you got Smith and Jones in the same town. Well, this is a fable, because Dr. Smith and Dr. Jones decided to trade places. The team stayed where they were. The patients were the same as they were. Nothing else changed. The only thing that changed for 1 year, Dr. Smith and Dr. Jones just traded places. It's kind of like what happened to me when I went out to Worcester and was inserted by my dad for 1 day a week into that practice where they said, this can't be done here. Write that down. This can't be done here, and then cross it out. Write that down. This can't be done here, and then cross it out. Because it's not true. It doesn't matter where you are. It's not true. And I'm going to prove it to you in a minute. I'm going to give you a proof in a minute. I want you to share the proof that I'm going to give you with your team. If your team isn't able to watch this right now, or maybe you're watching this on the video and you can replay this for your team, I think it would be awesome. But if not, write this down. This can't be done here. Change the can't to a can. And here's the story of Dr. Smith and Dr. Jones. So at the end of the year, Dr. Smith's practice, which was $1.5 million, Actually, he had the 500,000. Dr. Smith's practice, which was 500,000, with Jones working in it for a year, was now doing 1.5 million. Same practice, same patients, same team, same location, different dentist, different mindset. Now, what happened in Dr. Jones' case? Well, Dr. Jones was doing 1.5 million in that office. When Dr. Smith came out at the end of a year, he had taken over and he did his thing, and he brought that practice from 1.5 million down to just a half a million, just 500,000. And so I love that story because it's not just a story, it is the truth. It is the truth. I lived that when I went out to the Worcester practice and practiced for 1 day a week. Many, many, many years later, when my dad was dying and he asked me to take over that practice and I took it over, I relived that story because we transformed that practice into something very similar to my Framingham office in an area where they said it could not be done. There's another thing I would write down if you're writing any notes at all, and I hope you are. I hope this has been helpful so far. There's another thing I would write down, and that is Dan Kennedy, one of my mentors from eons ago. Dan really was instrumental in my understanding the psychology of why patients do what they do. And anyway, Dan said the attitude of the seller, and in the case of dentistry, it would be the hygienist, the doctor, the dental assistants, the dental professionals, the dental team members. The attitude of the seller, write this down, the attitude of the seller is far more important than the attitude of the buyer with respect to the likelihood of a sale. So what does that mean in dental? It means that the way we enter the conversation about what they have as problems and what they need and what we'd recommend and our deep core belief that this is the very best thing for them, and that is far more influential to the likelihood they say yes than the patient's attitude. Now, yeah, there's a few patients who have such terrible, poor attitudes, and you could stand on your head until you're blue and use the best verbal skills and have most passion and fire in your heart that this is the right thing, and they're going to say no unless their insurance covers it. But that's a tiny percentage. It's a tiny, tiny fraction of your patients, and it just is. All right, so I told you I was going to give you proof that 95% of your patients can afford very best option care if it's broken down by quadrants, or maybe a $4,000, $5,000 quadrant of dentistry, inlays, onlays, crowns, implants, whatever it happens to be. Let's say it's $5,000. And again, if they were able to be financed by one of the big financing companies for 60 months, and there are companies, our members use some companies that accept way higher than the typical care credit and so forth. They accept many more of our patients. But let's talk about this proof. How do I know that they can't afford it, no matter where you are? How do I know that? Well, the average American family, this is a writer-downer, the average American family is spending between $450 and $500 a year on their 3 cell phones, mom and dad and 1 kid, and you know that most families have more than that today, but I'm just going to use an old example, which is just 3 cell phones, and cable or satellite TV, because nobody's using those old rabbit ear things, the antennas on the top of the TVs. If you're old enough to remember that, you probably don't, but they don't even work anymore anywhere. Broadcast stopped with that years ago. So they either have cable or satellite. Now, they don't just have cable or satellite. They have Hulu and Netflix and Amazon Prime and ESPN Plus and pay-per-view and on-demand, and it goes on and on and on, and all the streaming services. And Elizabeth, my wife and I, we just laugh over this because a lot of families don't even remember which streaming services anybody in the family is even watching anymore. 6 months later. Are we still using Hulu? I don't know. Alexa was watching something on that. Well, my daughter Alexa's at Cornell. She's not here. And she's not using it at school. Anyway, we had something for my mom. We when she was alive, we had, I forget which service, but we got some streaming service for my mother. And I can't remember which service it was, but I do remember that she loved it. And years after she passed away, I remember Elizabeth saying to me, "Does anybody watch this?" I said, "No, I think my mom was watching that. Do we still have that?" And 3 years later, we probably, who knows what we paid. Jim just wrote into the comments, we're paying $280 a month just for our phones here. Just for the phones, not including cable or satellite. So it's about $450 to $500 a month if you take the phones, just the 3 phones, and your cable or satellite, and of course all the streaming services. So I was doing a welcome and intro call. This is about 2 weeks ago. This is the funniest story ever. I'm doing a welcome and intro call for one of our new Freedom Summit coaching members about 2 weeks ago. And I was telling that story about, my proof that 95% of your patients really can't afford your best option care. By the way, the reason I know that they can afford it is because financing a $4,000 or $5,000 quadrant over a 60-month period with one of the big companies, it's only about $85 to $95 a month. So it's under $100. They're saying no to you. They're lying. They're saying no. This is what the big lie is about. When they say no, they usually use the money as the reason. And the reason that they use money as the reason that they can't afford it is that it's easier to say to you, it's more comfortable to say to you, Doc, I really can't afford it right now. The twins just entered college and this just isn't a good time. Doc, I really can't afford this right now. My wife's car just went, we've got to replace it, and this just is not the right time for me to invest in dentistry. So they almost always use the money as an excuse, but I'm telling you, it's almost never the money. In fact, I think it's 5 words. It's never about the money. It's 5 words. Write those down. It's never about the money. Now, 5% of the time it is, but 95% of the time it's not. All right, so back to my story. A couple months ago, I'm doing one of these welcome and introductory calls for Freedom Summit coaching member in the Southeast in Florida. And one of the dental assistants, when I was in the middle of this proof, she starts jumping up and down. She says, wait, Tom. I said, what? She says, wait. She says, you missed 2 things. I said, awesome. I said, what did I miss? She said, well, first of all, she said their hair. So I paused for a minute. I said, I don't know anything about hair. I said, enlighten me. What do people spend on their hair? She said, well, women could spend $150, $200, even $250 every month in and month out for their hair. I said, I didn't know that. I said, thank you for telling me about it. I didn't know. I've never asked Elizabeth what she spends. I never asked Alexa what she spends. I had no idea. All right, so $250 for the hair once a month. I said, but you told me I missed 2 things, and that was only one. She said, she goes, you got to see the visual on this. She said, the second thing is, I said, 5? She rolled her eyes at me. She must have thought I was an idiot. She rolls her eyes at me. She said, no, this is 5. She said, they're nails. So I said, oh, what do people spend on nails? She says, yeah, it could be $50, $60, $80. I said, every month they're spending $80 on their nails. She started rolling her eyes again. She must have thought I am actually from a different planet. I'm from Planet Gems. She said, no, they don't do nails once a month. She says, if you're spending $60, $70, $80 on your nails, she said, you're doing it every couple of weeks, not once a month. All right, so it turns out that I had no clue, and the average American family, if you're only looking at their phones, their TV, and their nails and hair, so we're not looking at going out to eat, presents, gifts, local restaurants, trips. We're not looking at anything else, just those couple of things plus what she added in there, and you're looking at probably closer to about $700 a month, and they're saying no to $85 to $95 a month. So it's just easier. It's more comfortable for them to tell you, yeah, it's the money. I just not a good time for me to afford this right now. So if it's not the money, why aren't they accepting, best option care? Why are we practicing in an area where nobody accepts care? Well, you're not practicing in an area where nobody accepts care. And I've proven that over and over as well. It wasn't just in my Framingham office. It wasn't just in my Worcester office when I took that one over and turned that 95% fee for service and did some. Our 3 docs out there, the 3 GPs and 2 specialists, actually 5 docs, were doing some beautiful lifetime dentistry after we got the team and the doctors on the right page about all the different things that help you to get better case acceptance. Probably we have a limited amount of time, but I want to give you the biggest gem that I can as far as why they say no. And that is, all right, if you're a GP, some of you guys are specialists and I get that, but if you're in a GP office, and those are the guys we work with, if you're in a GP office, 95% of the dentistry we do is to fix problems that are asymptomatic. The patient doesn't know about unless we tell them or show them. So patient walks in, sits down, says, Doc, I think I just moved from Oshkosh to your area, and I think I just need a cleaning and a checkup. It's classic. Anything bother you? No. Anything broken? Anything hurt? No. Nothing at all. Anything you want me to look at? No. I actually saw my dentist just 6 months ago, and she said it was great and whatever. So classic general dental new patient, general practice new patient comes in, sits down, you look in their mouth, and they say everything's fine. They think everything's fine. They have no reason to suspect otherwise. Not unusual to see periodontal infection. Not unusual to see open margins, as in like wide open margins. It's not even unusual to see some fractures if there's no symptoms and there's nothing sharp. I mean, recurrent decay, stuff on the x-rays. It's just not unusual for them to have a lot of dentistry needed in order for them not to continue to deteriorate the condition of their mouth and their joint and their jaws and their muscles and their occlusion and really their comfort, their quality of life. So it's up to us to be the one who, lets them know. So what we do let them know. We say, this is what I see, and you show them. They can see it even on the photos or in the scans or whatever, however you're showing them. And then we see, this is what you should do. Here's what my recommendations for care. And a lot of them say no. Well, why do they say no? It's because we missed the most important step. Write this down. We tell them diagnosis. This is what we taught in dental school, by the way. We tell them the diagnosis, what we see. We tell them the treatment plan, what we recommend. We missed the most important step. The middle step that we're all shortcutting, the middle step that we're missing is let them know about the potential consequences of not taking action right now. Let them know about the potential consequences of not taking action now. And that in itself would probably be a half-day seminar because it's different with each patient and specifically with each diagnosis and each potential treatment plan. If we see this, if we don't do something about whatever this is, so it's different. So we're not going to get into the details of that, but I'll tell you that if you write down, just talk to them about the potential consequences of not taking action now, create a sense of immediate and urgent need. Write that down. Immediate and urgent need. Those 4 words, immediate and urgent need. Now, if you don't believe that there is, then you don't do that. I'm only suggesting you do that if you believe that not taking action could have significant consequences to them in their health, in other words, the degradation of whatever's going on, the amount of time it's going to take you and them out of work and away from their family to fix the problems as they get worse, and the cost, the investment. So we look at 3 areas. All right, so you just got to tell them the truth about this and what you see and the potential consequences. Okay, so there's another false belief. There's another false belief that maintains a stranglehold on most practitioners and practices, and that is that you really can't safely reduce or eliminate PPOs from your practice. And that can't be done in my area. Tom, you don't understand, not where I'm practicing. You might have done it in Framingham, I get it. And Worcester, maybe that was a little bit more difficult. But you got to understand that it can't be done in my area. Can't be done in my area. All right, so there's too many dentists who just accept that whenever all the other dentists say that it can't be done in my area, that it really can't be. All right, so some people, and this is what they said in Worcester, it's because of the factories and the unions, and it's the type of insurance we have here. It's this or that. So I only have a few minutes left, but I just want to tell you a couple brief stories. And one is Dr. Ginger Bratzel in Socorro, New Mexico. Met her some time ago, and she was coming into the Freedom Summit program, and she said, Tom, she says, I'm not sure if I want to just close my practice in Socorro. We're in the mountains with the indigenous Indian population, and they literally just don't have any money. As in, they don't have any money. She said, I grew up here. She said, I know they don't have the money for the dentistry. I'm wondering, before I do Freedom Summit, should I just move my practice? And it was close it and open a practice in a little better area, a nicer neighborhood where they can afford the dentistry. I said, do you like the area? She said, I love the area. These are my people. I said, then stay where you are because we're going to make it work. And she did. She thrived. She thrived. She built that practice. She served her population in a way that she had always hoped she could. Not just because her belief was different, but because her whole team believed now. So the team and doctor believed that as they developed the skills to get across the need for that kind of care and the quality of that care and the immediate and urgent need, and they did. There's also Dr. Scott Winter and his wife, Dr. Anna Balaka, in New York, and they were in Freedom Summit when they dropped all of their PPOs, and I don't recommend anybody does that all at once, but now in New York, in a really, really tough area to practice without PPOs, Anna is booked out 5 weeks solid. I spoke with Scott not that long ago, and Scott said, yeah, they're doing amazing. She's an amazing woman anyway. They're both amazing, and now 5 weeks solid, 100% fee for service in New York. There's Dr. Curtis Zarang in the deep Louisiana bayou where he was $1 million in debt and said, he says they don't have any money in the bayou. If they had money, they wouldn't put it into their teeth. And not only was he able to retire the $1 million in debt, but he then put $2 million away. And he said he only needed about $1 million to retire very comfortably in the bayou. And he has $2 million. He's still practicing today. And again, it's not the area. Gordon Schloem in Detroit, he was like just 5 minutes outside of the heart of Detroit during the time when all the automakers went down. And he showed me photos. His whole neighborhood was basically the businesses were boarded up. The windows were boarded up. They had just taken off and moved out, and many of them never came back. and he turned that practice around and thrived even in that situation, even in the Detroit area, and did really, really well. So hopefully you can see how shifting your mindset to really believe that every patient wants, write this down, my patients want the very best possible health care. With the right approach, my patients want the best health care. And write this down, with the right approach to treatment planning and why it's necessary and what the immediate and urgent needs are and the potential consequences of not taking action. With the right approach and presentation, my patients, write this down, my patients are willing and able to afford my best care for optimal lifetime health. Which, in turn, if you're doing that and you're gaining more acceptance, and you will, that in turn can help you improve your financial position to the point where you're ready and able to begin to reduce your dependence on PPOs, which is what this is all about. It's all about serving your patients at the highest level so that in turn you don't need to be kowtowing and answering to the insurance companies. So this is just one of many ways that we help our coaching members rapidly and sustainably increase revenue so that they can start to safely reduce PPOs. Helping general dentists, and I mentioned before that we work with general dentists, helping general dentists reduce loss from PPOs and increase their revenue, and more important, their profit. Revenue is nothing without profit, is exactly what we do. And you'll see on your screen there, it says in the comments, if you'd like my team to reach out and see if we're able to help you safely reduce, we can just have a short conversation. If you type liberation, into the comment. Now, you don't have to be with me live. You can be watching the video replay. My team always looks out. My PPO Exit Breakthrough coaches are always looking at comments throughout our PPO Exit Facebook group. So if you write down the word liberation in the comment, whether you're live with me now or you're just watching the video, they will reach out and you have a short, maybe 5-10 minute conversation to see if we can help you at all. The question is, can we help you rapidly increase your revenue so you can establish that position of financial strength so you can begin to safely withdraw? So some of our doctors don't want to get out of all of them. They just want to drop one or two, their worst ones, the ones that they hate. That's fine. Or if you want to go 100% fee for service, we can help you with that as well. So type liberation into the comments if you'd like my team to reach out. Or if you'd like to skip to the front of the line, just click on the link that's in the description below. It'll be in the actual post once this is on video. So if you're watching this on video, that link is in the post. So if you click on that, you can skip to the front of the line because you can book your own 5 or 10 minute, very short call, but just enough to, during the free it's called a PPO reduction call. During that call, we'll ask you a few questions about your practice to see if we might be able to help you safely reduce the PPOs. And if you're a general dentist and you own your practice and you either type liberation where we reach out or you use that link to schedule your own, either way, we'll see if we can help you out. And if not, hopefully we can give you a few pointers and a few more gems and set you maybe with a few other resources in the right direction during that journey anyway. So thanks for being a part of our PPO Exit, our movement, and have a great weekend. And remember, you are only one gem away. Take care, guys.